In the last weeks of 2019, while the world was ready to welcome the year 2020, many local hospitals in Wuhan, China reported an unusual number of cases who had severe pneumonia without a clear cause, and they were not responding to any form of existing vaccine or medicines.
In a matter of days, Dr. Li Wenliang went from treating patients to becoming one. The 34-year-old ophthalmologist diagnosed Saturday with the Wuhan coronavirus. But if action had been taken when he and others started sounding alarms, the severity of the outbreak might have been understood sooner. Struggling to communicate, Li spoke with CNN briefly by phone. You can hear the hospital machines pulsing in the background. Within days, they closed the suspected source of the virus, this seafood market, and they announced the outbreak.
In the weeks that followed, the Wuhan Municipal Health Commission maintained that there was no obvious evidence for human-to-human transmission, no infection of healthcare workers, and that the outbreak was, in their words, preventable and controllable. And with that, the people of Wuhan continued about their normal lives.
Then came a sudden jump in infections. China's central government took over, scrambling to contain a spreading virus with a rising death toll.
We're going to begin here with the outbreak of a mystery virus in China that now has the World Health Organization on edge. At least 4 people have died and hundreds more are sick, though there are concerns 5 times as many people could be infected. Tonight, Chinese health officials say the illness, which is a new strain of coronavirus, can be passed from person to person, stoking fears that it could be moving faster than it can be contained.
Very worrying for India. One positive case of the coronavirus has been detected. It has been detected in Kerala. The student was studying at the Wuhan University, which really is the epicenter of the coronavirus. The patient is stable, we are being told, is being closely monitored.
And tonight, Italians recording messages to send out to the world their warning. Here's ABC's Maggie Rulli.
Tonight, Italy staggering as the virus rages. 475 more deaths in 24 hours, the most in a single day. The death toll approaching China's, but Italy with just a fraction of the population. New video inside an ICU unit in the hardest hit part of Italy shows doctors fighting a relentless battle, working endless hours.
Spain's health system is stressed to the breaking.
रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
A 56-year-old man has tested positive, is being treated in Sion Hospital. The house in which he was living has been sealed by the municipal authorities. Remember, Dharavi is the sprawling slum colony in the heart of Mumbai with over 15 lakh people who live there, cheek by jowl, spread over 630 hectares. There's always been the fear that if coronavirus comes to a place like Dharavi, then it could well spread. As of now, the authorities are denying that there is any community spread. Let's take a look first at how Kerala is the one state that perhaps is best placed to meet the corona challenge.
Till 24th March, 4,516 samples of suspect cases had been sent for testing, out of which 3,331 came back as negative. 12.1 tests per lakh of population, Kerala has the highest rate of testing in the country. The state has also announced hospitals will be opened in every district to deal exclusively with COVID-19 patients. Hostels in some districts are being turned into COVID-19 isolation wards. The Kerala government has also appointed 276 doctors in the health department to help formulate better medical policies in its fight against the pandemic. More than 5,000 doctors employed in the government facilities alone. This brings the doctor per bed ratio to 7.5, which is excellent compared to the national average.
2,069 positive coronavirus cases in the country, so it's crossed that 2,000 mark. 53 deaths have taken place, 156 people have recovered. Today morning at 9 o'clock will be a video message by the Prime Minister, and the search is on for the Tablighi cleric and 6 others who were involved in organizing the religious gathering in early March in Nizamuddin in Delhi. Global developments, and over 1 million cases of coronavirus have been detected. There have been 52,973 deaths. In the United States, over 5,900 deaths have taken place, and the cases have crossed 244,000. In Spain, there have been 950 deaths in the last 24 hours, the highest in a day. In Italy, 13,915 are dead. And the World Bank has approved $160 billion emergency aid for France. Over 5,000 people have died there.